All right, just a small pinch. Okay, all done. Just labeling this now.
I'm sorry. There's nothing more we can do.
Nothing? After all this time?
Nothing medical. I'm truly sorry.
For 40 years, hundreds of black men believed doctors were helping them. They had no idea the cure already existed.
When do I get better, Doc?
Just keep coming back. The men were told they were being treated for bad blood. Every visit looked routine. Every promise sounded reassuring. We'll take another blood sample today.
If you say so.
Then penicillin became the standard cure for syphilis. But these men never received it. Is there anything new that can help? Not yet.
Year after year, the study continued while the disease silently damaged bodies and families. I've been waiting a long time. We'll schedule another visit. Everything changed in 1972, when a whistleblower exposed what had been happening behind the scenes. The public deserves to know the truth. The Tuskegee Syphilis Study ended after national outrage. It remains one of the darkest ethical failures in American medical history, and forever changed the rules protecting research participants. How could something like this happen for 40 years?
In the quiet fields surrounding Tuskegee, Alabama, in 1932, the morning sun rose over cotton farms where generations of families worked the land, hoping each harvest would be kinder than the last. Life was hard, especially during the Great Depression. Money was scarce, medical care was even scarcer, and many believed that any opportunity to see a doctor was a blessing. Among those men was Isaiah Carter, a hard-working sharecropper whose hands bore the scars of endless labor beneath the southern sun. He had heard whispers around town that government doctors were offering free medical treatment for what locals simply called bad blood, a common phrase used to describe a variety of illnesses ranging from anemia to fatigue and sexually transmitted infections. To Isaiah, it sounded like hope. Free examinations, meals on clinic days, transportation, and even burial insurance were promises that seemed impossible to refuse. So like hundreds of other black men from Macon County, he signed his name. He never knew he had become part of an experiment. The doctors wore clean white coats and spoke with confidence. They smiled warmly, took blood samples, examined their patients, and assured them they were receiving special treatment. The men trusted them because they believed doctors existed to heal. Few questioned the authority standing before them. But behind closed doors, another conversation unfolded. Researchers from the United States Public Health Service had begun what they called the Tuskegee Study of untreated syphilis in the Negro male. Their goal was not to cure the disease, but to observe what happened if syphilis was left untreated over the course of a man's lifetime. Isaiah had syphilis. No one told him. Months became years, years became decades. The disease slowly marched through his body like an invisible predator. At first came headaches and exhaustion, then aching joints. His eyesight dimmed. Some of the men began losing their hearing. Others suffered strokes, paralysis, heart damage, or mental decline as the infection attacked their nervous systems and organs. Whenever Isaiah returned to the clinic, the doctors reassured him, "We're taking good care of you." He believed them. One of the cruelest moments came when the men were told they needed a painful spinal tap. The doctors described it as a special free treatment, even though it was actually a diagnostic procedure. Many endured the agonizing needle believing it was helping them recover. It wasn't. Then history changed. In the 1940s, scientists discovered that penicillin could effectively cure syphilis. Across America, hospitals quickly adopted the antibiotic as the standard treatment. Countless lives were saved, but not in Macon County. The researchers made a deliberate decision. The men in the Tuskegee study would not receive penicillin. Even when government treatment programs began offering the medicine, officials worked to ensure the participants remained untreated so the experiment could continue. Some were prevented from receiving therapy elsewhere. The study's scientific objectives had become more important to its organizers than the lives of the men themselves. Isaiah grew older. His wife watched the strong young man she had married slowly disappear. She could not understand why the medicine never seemed to work. Tragically, some wives contracted syphilis from their husbands, and some children were born with congenital syphilis because the disease had never been treated. Entire families unknowingly became victims. The experiment stretched through World War II, the Korean War, the Civil Rights Movement, and the first footsteps on the moon. 40 years. Generation after generation of doctors inherited the study. Very few stopped to ask whether it should exist at all. Then, in 1972, one man refused to stay silent. A public health service employee named Peter Buxton learned about the study and repeatedly argued that it was unethical. After being ignored internally, he revealed the story to the press. Newspapers across America published the shocking truth. The nation reacted with disbelief and outrage. How could government doctors knowingly watch hundreds of men suffer and die when an effective cure had existed for decades? Public pressure exploded. The study was finally shut down. Investigations confirmed the terrible reality. Approximately 600 men had been enrolled, including around 399 with syphilis and 201 without the disease who served as a comparison group. Many participants had died from complications of syphilis, others experienced severe disabilities, some infected their wives, and children were born with preventable infections. Lawsuits followed. The surviving participants and their families eventually received financial settlements, and new federal rules transformed how human medical research is conducted. Institutional review boards, informed consent requirements, and stronger ethical protections were established to help prevent abuses like Tuskegee from happening again. Yet the scars remained. For decades afterward, the Tuskegee study became a symbol of broken trust between many African American communities and the American medical establishment. Its legacy echoed whenever public health officials asked citizens to place their faith in medicine. Finally, in 1997, 65 years after the study began, President Bill Clinton welcomed the remaining survivors and their families to the White House. Standing before the nation, he spoke words that should have been said long before. What the United States government did was shameful. He apologized on behalf of the country. The survivors, now elderly men, listened quietly. No speech could restore the years stolen from them, repair damaged bodies, or return lost loved ones. But the apology acknowledged a truth that history could never erase. Today, the Tuskegee Syphilis Study stands as one of the darkest chapters in American medical history. Not because science sought knowledge, but because ethics were abandoned in its pursuit. It serves as a permanent reminder that every patient deserves honesty, dignity, and informed consent, and that medical progress must never come at the cost of basic human rights. The voices of those men, once ignored, now endure as a warning to every generation that follows. Never again.